Well, we learned some disturbing statistics today about Alabama's healthcare system.
They were brought up at a state of health discussion hosted by the Montgomery Chamber of Commerce. WSFA 12 News reporter Julia Avent listened in on the conversation.
Louis Limbazzi, the dean of UAB Montgomery Regional Medical Center, shared some dismal stats, including the fact Alabama has fewer physicians than almost any other state in the nation. And 17% of Alabamians do not have health insurance, one of the reasons many healthcare providers are facing financial problems.
There are real challenges on the cost side of medicine, just like everything else. Hospitals have to pay increased wages, and they wind up getting squoze.
Limbazzi says if Alabama wants to see change, state leaders must get out of their own comfort zones and discuss solutions, a major topic of the state of health discussion.
We have a lot going on with the president's agenda and what's going on in Congress, and there are a lot of potential changes that might come. So we're going to talk a little bit about that and then how that might impact health care and how it's delivered here at the local level.
In the meantime, Ted Haas with Blue Cross Blue Shield of Alabama says his organization is trying to help. Currently, he says they're doing what they can to help Jackson Hospital keep its doors open. And in the midst of all the negative news, organizers say it's also important to acknowledge there are also some positive aspects to the current state of Alabama healthcare.
There has been a remarkable amount of emphasis on rural health care. I think in fiscal year 21, the federal government spent $21 million in Alabama to improve that. UAB has gotten $10 million in grants for rural health care education. So there's and the state has stepped up to fund a lot of rural health care. So it's not like it's a complete desert or like people haven't done anything. I don't want to leave that impression at all.
But the focus on the coverage gap, which impacts the patients and the providers. While Limbazzi says quality of care has improved since he was in medical school, his concern, Mark, is how will the patients in the hospitals afford the cost?